minutes, we're going to do a quick palpation screen just to test the integrity of the knee and lower leg, because with something like this is pretty straightforward. Okay? I already asked her a couple of questions, but for today, I'm just going to show you a quick palpation screen. Tomorrow, okay, we're going to do transfers and bed mobility, and then depending upon time, I'll show you a little bit more involved evaluation, including a subjective, objective measures, as well as some transfers and bed mobility. Okay, just so you can actually see what it's like. Okay, because now we have an actual injury to work with. Okay, so she injured herself for you guys. So what's the first part of the palpation screen?
Introduction. Muscles.
A palpation screen.
Muscles.
Yeah. Okay. For what? Hypertonicity and trigger points. Okay, so let's just focus on the knee and lower leg. Okay. Now, in an actual eval, I would start with introducing myself, subjective, and if need be, vital signs, and then I would go into a palpation screen. But right now, I'm just going to go right into it. So I'm actually going to assess for trigger points first. If anything's tender, let me know, or just jump like that. Now, because the area is so obviously injured and bruised, I'm going to, at least for now, forego palpation on it, because it's going to be very tender. Okay? Any tight points anywhere?
A little bit.
A little bit here?
Painful.
Okay. I definitely feel one here. How does that feel to you? Right there. Yeah. And as you can see, as I'm applying a little bit of a cross-friction motion, you can actually see her grimace as I do so. Right there. Okay, so that tells me that that's a tight spot. Okay? Okay. Now let's check out the medial aspect. Normally I'd be on this side, but since you guys are filming on that side, I'm going to stay over here. And a little bit. That's fine. That's fine. That's fine. That's okay. Gastrocs all right. Check out the soleus. A little bit tender there. Not some. A little bit there. A little bit here. Yeah. And as I start to go around down the lateral compartment, a little more distal, it becomes a little bit more tender. Does that make sense?
Yes.
Why?
Swelling. That's where the
Going towards the area of the injury, right? Okay. Now, again, as I said before, in terms of muscle palpation, I'm going to forego it on the actual injury site because you can see it's obviously swollen and bruised. Okay. But what's next? Temperature. Okay. And how do I do that? With the back of my hand. Why the back of your hand?
more receptors.
Okay. So I'm just going to go around her knee and lower leg, just briefly assessing temperature. Okay. And then as I go over the injured area, it definitely gets warmer. Okay, Mike, can you give me back your hand to verify? Right through here, right through there. And then now go over the injured area.
Yeah.
A little bit warmer, right? Okay. What next? Swelling, okay. Now, in something like this, it's obviously visibly swollen, okay? And exactly, that's a good question, though. To what degree? And I would also want to compare bilaterally as well. So what I'm going to tell the patient is, as I'm palpating your ankle, this is what it should feel like. Okay, remember that feeling. Now, what if I do it on this side? More tender? Mm-hmm. She doesn't even have to tell me. Already, she's giving the facial expression that's much more tender. Okay. Now, as I go into a more complete eval, I would want to know, well, how tender? I may ask her a 0 to 10 scale, or location, or is it radiating? Okay. But again, for the purposes of a palpation screen, I'm just palpating for swelling. And notice I'm doing it very gently because it's obviously bothering her.
Yeah, it hurts the most underneath.
Where?
The swelling on top. Yeah, like
Right there? Okay. What do you think is most painful on her, based on what she's telling me?
CF. I see CF. I think it's CF.
But remember, the calcaneus is over here.
ATF.
No,
That's over here.
calcaneus. I mean,
But here's where she said, yep. Mhm.
posterior tib.
Posterior tib.
And specifically, posterior tib what?
Tendon.
Tendon. Okay. But I'm actually, to clarify, I'm actually more on a bony structure.
Lateral
Right
malleolus.
around. Yeah. Mhm. What do we think?
The lateral malleolus.
Lateral malleolus. Okay. So that's pretty much a quick palpation screen. Tomorrow, time permitting, I'll be a little bit more thorough, and I'll also try to include the palpation screen tomorrow as well, just so you can see, you guys get the idea of the subjective flow as well as overall component.